Hi everyone, my name is Jordan and I'm the Executive Director of the MLK Health Center and Pharmacy, and today I'm excited to sit down and chat with Dr. Elizbeth Disbrow.
Hi, thank you for having me. I'm the Director of the Center for Brain Health at LSU Health Shreveport, and I also work here at the Bridge, which is a brand new dementia center located in our community.
Absolutely, and we're actually neighbors, so we're really excited to get to have this conversation today. So if it's okay with you, I think we'll just jump right in.
Excellent.
So I think the first question is, what is the difference between dementia and Alzheimer's? Because they're not interchangeable terms.
Correct. People use them interchangeably. Alzheimer's disease is a specific type of dementia. So there are several different diseases that lead to cognitive dysfunction. Parkinson's disease, people are 4 to 6 times more likely to get dementia or cognitive dysfunction. Alzheimer's disease is a specific disease mechanism involving plaques and tangles and brain atrophy that is one of the many causes of dementia, and it's the most common.
Interesting. So, what are some things that people need to be looking at as early signs of dementia and Alzheimer's? Because people forget their keys. Should they start panicking?
Yes, I get that question a lot. I can't remember where I parked my car. I have dementia. That is part of normal aging. So there's a normal aging process where it takes longer for us to remember things. That memory doesn't function as well as it used to, just like a lot of other parts of our body. But when you should be concerned is when that memory deficit starts to interfere with normal functioning. So the person's having trouble doing their job. A really common one is they get lost going someplace where they've been many times before. And one of the tricky things here is that people who have the symptoms don't always recognize it. So what I say to people is we need to watch out for each other. Because it's a lot easier to recognize it in someone else when they call you again an hour later and have the same phone conversation with you than they did earlier.
Absolutely. So if someone, is witnessing some of these warning signs in a loved one, where do they go for screening? Where do they go for that next step?
Well, they should come here in the Shreveport area. We're the Bridge, 851 Olive Street, and we provide free screening. There's 2 groups here under one umbrella. One is the Bridge Alzheimer's and Dementia Resource Center. They're a community based group, nonprofit that provides support groups and education. What do I need to do financially if my spouse or my parent is diagnosed with Alzheimer's disease? Every Wednesday we have the first Wednesday of every month we have an educational group. Last month they talked about scamming in elderly folks. So the topics are really broad and they're open to suggestion. So we bring in experts on all sorts of different relevant topics. And then on my side, the LSU side, I help folks get access to specialty care. I work in the neurology department, and so I can help folks get in to see a psychiatrist or a neurologist if they need to. And our group, through research grants, provide more extensive memory screening, MRIs. We do a blood test, so we're doing some research on biomarkers, and all of our services are free. So we try to provide wraparound care at one place. We help folks figure out about whether it's time to put their loved one in a nursing home and what the best nursing home fit would be, and talking about the financial aspects of that. And so we really take any question. There is no question that is outside of the bounds of what we can try to help you with.
And all of that counseling is free as well.
All of it is free.
This is just incredible. So someone has come, they've gotten screened, and they've seen the specialist, and they've been diagnosed with Alzheimer's. And if they're in those early stages, is there anything that they can do to prevent its progression?
So there are many things that, there are many studies going on about progression. Most of them apply to people who don't yet have full-blown Alzheimer's disease. So Alzheimer's disease, I sort of explain it like dominoes. Once that first domino tips over, it starts a cascade of other pathology, and we're not good at stopping that yet. we're working on it, but we're not good at stopping that yet. The immense amount of research that's going on in new medications and in prevention is focusing more on the earlier part of the disease. So someone who's my age, what I would do is exercise, very important. One of the things that goes wrong in our nerve cells is that the energy producing, it's called mitochondria, but it's the energy powerhouse of the cell, starts to fail. But when you exercise, you build new ones. You build new ones in your muscles, and that also improves the energy production in your brain. So exercise, very important. All the stuff that they tell us about heart disease actually applies to preventing Alzheimer's disease. So no soda, try to eat healthy. I don't endorse any particular diet, but some people talk about Mediterranean diet, that sort of thing. So try to keep away from high-fat processed foods. Diabetes is a big risk factor. So if you have diabetes, make sure that you take your medication when you're supposed to, and make sure that it's well controlled. And these are all things that we can do pretty easily to prevent our long-term risk.
So that is on the prevention side.
Yes.
This is kind of a random thing, but I've always heard that blueberries are the antioxidants in it can help prevent Alzheimer's. Is that just, a headline on social media, or is there anything behind, that's just something I'm personally interested in?
It may be. There's research about flavonoids, and I think it's safe to say that I've reviewed grants on broccoli. So there's a lot of different foods that are in the mix, but less meat, more vegetables and fruit diet, definitely better.
That's wonderful. I've heard your talks before, and one of the things that we haven't discussed yet is the importance of oral health for brain health. Could you speak to that a little bit?
Yes. So there's a link between bacteria that can grow in your mouth, and it can be bad for your heart and for your brain. And so it's a good idea to go to the dentist regularly and to floss. So the current thinking is that flossing is what is really important in keeping that bacteria down.
Interesting. It's good to know. I know I can definitely floss more.
Yes, that's an easy one for people. This can be overwhelming, all this behavioral change, but flossing, $2 for a thing of floss, and you just do it every day.
It can have a real big impact long term.
Yes, and it's very accessible.
So we've talked about, some warning signs and ways to go to get diagnosis and next steps. But I wanted to take a minute and talk about the loved ones that are caring for people with dementia or Alzheimer's. Do you have any advice for them who are, day-to-day caring for their loved ones struggling with these diseases?
Yeah, so a really common occurrence is that the care provider passes away before the patient because they are not taking care of themselves, and it's very easy to do. I have 2 teenage children. I take care of kids a lot, and it's a lot easier to take care of the kids than to go to my own doctor's appointment, and that happens also with care providers of people with dementia. It's hard to leave your loved one alone when you go to your appointment. Perhaps you've spent a lot of time that week waiting in doctor's offices for your loved one's appointments, and the last thing you want to do if you have a few minutes left to yourself is to go sit in another doctor's office. But it's really important, and we are working on some respite care to allow people to not only go to the hairdresser but also go to the doctor. So it's very important that the care provider also take care of themselves. And we can help with that as well. I can help. We have a family practitioner we work with a couple. So if you don't have a primary care doctor, you give us a call. We have some great recommendations because that is a big roadblock for people.
Absolutely. That's incredible. It seems like, the services you provide are pretty all-encompassing, and the fact that it's free. This is just such an amazing resource for our community. This is much needed research and much needed services. So thank you so much for talking with us today, and please extend our thanks to your team that's doing this work. You guys are really advocating for our community, both locally and statewide and at the national level, and just want to make sure that our community is grateful to the work that you guys are doing.
Thank you.
Thanks, everyone.